Hi everyone, this is Sean with the MassSupport Network here with the Massachusetts Weekly Public Health Report for Friday, September 25th, 2020. So we're going to start by looking at cases under quarantine right now. These are suspected cases going monitoring, and this is where we were last week, and this is where we are this week. There's a lot more cases under quarantine and monitoring right now. So that's something to be aware of. This may mean that testing is a little slower this week if fewer people are getting confirmed cases, or just we're catching a lot more as a sign of increased cases. We'll see more about that in a moment. In terms of actual confirmed cases, here's where we were last week with 5,200 and change isolated, and an additional 500 more cases in isolation this week. Of course, since isolations generally last 2 weeks or less, that means that these are a lot of more new cases here to both replace the existing ones and increase. So looking at how our hospitals are doing, slight decrease in hospitalizations, but within the margin of error there, they are basically holding out, and increases in the other measures, more people in ICUs and more people in intubations or on ventilators. So something to keep an eye on as those lower numbers increase. That's really where the strain on our hospital system comes from. We do have plenty more hospital beds. We don't want to fill those all up. We're at less than a tenth of where we were in April, but the ICUs and the ventilators are a lot more limited in supply. So the demographics in the last 2 weeks of COVID case counts. So last 2 weeks, the average age was 37 for new infections, while hospitalizations had an average age of 63, and deaths had an average age of 81. This is important because while far and away the largest number of new cases is happening still in the 20 to 29 age demographic, it is older people who are bearing the price for it, who are getting hospitalized and dying. And that is a trend that's showed across the country where younger people are currently driving the spread right now. So remember, if you're younger, you may not have adverse outcomes from COVID-19, but it's very easy for you to spread it to someone, especially a family member who will. Checking in with our contact tracers. We are still seeing about the same rate here, just under 92% of case outreach completed. Last 2 weeks, we've gotten about just under 90% of the initial cases, with 85% of those completed within a single day. And we are getting more on the contacts, which is not the actual people who are exposed, but they're people who they've been in close contact with. The cases are the ones who've tested positive. The contacts are those who've gotten exposure from the cases. So we are getting out 2 more of them in the last 2 weeks, which is good because that helps us proactively get people to quarantine and prevent cluster outbreaks. So looking statewide, here is where we were 2 weeks ago, or rather 1 week ago. And remember, this chart shows the incidence by population, with towns that have had fewer than 5 total cases not showing up in colors there. And in green or higher are towns that have 4 or more cases per 100,000 residents, which means that very populous towns can often show up lower, even though having a lot of cases, and towns with a smaller population will often show up higher on the scale with a fewer number of cases. So here's where things were last time, and here's where they are with our latest data here. So important things to note there. First of all, there is a lot more yellow on that chart right now. A lot of towns that were in the green range of fewer than 4 cases per 100,000, switching to between 4 and 8. So that does show more community spread there. Also, it seems to be a few more towns just in terms of numbers of communities showing up on this map right now. Also worth noting, the daily state rate has gone up by 0.3 cases per day. Last time we were at 4.6 new cases per day per 100,000 people, and now we're at 4.9 cases per day per 100,000 people. So that is significantly more there, even though it's just a fraction there. That is still, with a state of almost 7 million people there, that is, back of the envelope math, an extra 20-something cases per day. Looking at positivity, this is where more tests are coming back positive, what percentage of them are. Despite this increase in cases, however, our state rate has gone down from 0.90% to 0.85%. So, this really speaks to the volume of tests we're putting out here in this period. So, yeah, we're really doing a lot of tests these days. You can see now, though, with 0.85 being our state average, any community that's in one of the 3 darkest blue colors there is above the average and is having either less tests or more cases than in general. So that's in there because that bracket does break off at 0.85 exactly. Some places to be aware of, especially down in Nantucket, is still having a big cluster there. Also, the city of Boston is showing up yellow on the earlier maps for fewer than 8 cases per 100,000 people per day, but as the most populous city in the Commonwealth and the 21st largest city in the country, it's so big that kind of gets absorbed by that, but it is very close to crossing that red area with, I believe, 7.9 cases per 100,000 people per day in the city. It is something to be aware of. Checking quickly with our colleges that are reopening and the testing going on there. So since the last week there, we've conducted over 240,000 new tests in institutions of higher learning, which is just a phenomenal number there. And only 130 of those cases, of those tests, have come back positive, or excuse me, rather, people have been identified as positive and confirmed cases. Oftentimes, there will be a higher number of positive tests than there are confirmed cases. This is usually due to repeat testing in some areas, but we're not seeing a massive outbreak due to colleges like some places in the Midwest are, with a total of 629 cases total. So, and that is the new cases in the last week is slightly less than it was the week before, with 168. However, we should, in an ideal world, this would go down just because we should be catching all the new cases earlier as people are first getting back to school. And if there's little community spread, these should be dropping pretty quickly. All right, and so just looking at the state trends at all, overall, this is what we've been seeing over the last month. Some ups and downs there, but there is a steady upward trend getting towards an average of 400 new cases per day. That is something to watch out for. We are steadily trending upward going into the fall. All right, and one last thought before we go out into our weekend. We've seen a lot of different mask types coming out over the pandemic. Here's one that I would probably recommend as not the safest or most effective mask out there. The live snake mask. I'm going to go ahead and say that this poses some risks and is probably not very effective in filtering COVID particles. And as someone on Twitter said, snake masks can be quite constricting. All right, and for more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, not a snake mask. Wash your hands, and we'll be here if you need us. Stay safe.